also in China in recent years, due to the industrialization and also the quick urbanization, there are quite a lot of the food safety crisis. So I'm really curious about your comment on that.
If you're referring, there have been a number of incidents, over the last few years. I think people are very familiar with the problem with melamine and some concerns about animal drug residues in fish. I mean, I think these are problems that occur sometimes. They're disturbing because they put consumers at risk, but they're problems that I think we've learned from, and this is where I think we're doing the hard work with our Chinese regulatory counterparts to be sure that we've got measures in place to prevent these problems. I mean, the key is that we don't want to be responding to problems, mistakes, bad events like that. Consumers want us to prevent those problems, and that's what we're working, so hard with with our counterparts in the Chinese government, to be sure we're preventing those problems from happening in the future.
I also think it's important to remember that there is room for all of us to improve food safety systems everywhere, including the United States.
Consumers have a right to expect that we're doing everything we can to make food safe, and that's the mission that we're on at FDA, and I know the Chinese officials have the same goal. You have your own new food safety law, which we're watching with interest as you implement your new food safety law. So again, I think we're all in it together, and trying as government authorities to build the systems that can be effective in preventing problems and protecting consumers. That's really what it's all about for all of us.
So what do you think are the major concerns of China's food safety today?
I think China is no different than the United States or all countries who are again trying to, in a globalized, high-tech food system, working to be sure that we've got the controls in place to prevent problems. It's a challenge to feed so many people, to try to provide economical food supply, and it's just critical that in doing that, that we be sure we've got the right food safety standards in place, and that we're not cutting corners on food safety. So that's a challenge for all big food systems. So that's what we're all working on.
And also it's said by some that during a certain period of time, during industrialization, there must be a spread out of the food safety crisis, just like maybe in the 1960s or 70s in the U.S.
Mm-hmm.
You also have similar problems as China today.
I would only add that industry is also part of that picture, because government agencies will almost never have enough people to inspect every day or every month or even every year or every several years all the facilities that produce food, that transport food, that process food, all the farms that grow food. So much of the responsibility has got to lie with industry to ensure that food is safe, with the government being vigilant to make sure that industry does meet its obligations.
So what are the major food safety threats today in the U.S.? So do they all the same with that over 20 years ago?
Well, the food safety problems do tend to evolve and change over time, but there are persistent levels of illness associated with salmonella and other familiar bacteria like that. And food safety, though, affects a wide range of commodities. It affects meat products and produce, and almost any food can become hazardous if it's not produced properly, if preventive measures are not taken. I think that's an important point here, is we have to take food safety seriously with respect to all food commodities, and then target the ones that we most associate with risk, but recognize that any food can be made unsafe and any food can be made safe, based upon the preventive practices that are observed.
I would only add that I think the principal risks are microbiological rather than chemical, although of course there can be chemical risks.
Mm-hmm.
And I think that's something we've learned over maybe the last 20 or 30 years. 40 years ago, we didn't know very much or certainly nowhere near as much as we do now, about microbiological risks from food.
So based on the experience of FDA, what are the top key points to secure food safety?
Okay, we keep coming back to the message of prevention, of every company that's producing food, understanding what the potential problems are, potential hazards in that food production system, and having in place the preventive measures to minimize those hazards, to reduce the chance that the food will be contaminated. And that prevention has to happen at every step along the production, processing, marketing chain. The so-called farm-to-table food safety strategy has to be based on prevention at every step along the way. There's really no substitute for that. And again, industry has a role, government has a role. We've got to use the best science to understand what the problems are and what the best controls are to minimize those problems. But it takes a whole system working together to make the food as safe as possible. That's a strategy we're pursuing. And I think that's a strategy that most countries around the world understand is the right way to make food as safe as it possibly can be.
I would just add, consumers have a role too, as do restaurants, for example.
Mm-hmm.
All along the chain.
Yeah.
And you two mentioned prevention a lot. So if we put prevention a top priority, the risks assessment must be very important.
Yeah.
So how do how do you carry out this kind of assessment in your country?
Well, we gather a lot of evidence, a lot of data on foodborne illness, on what particular bacteria or other contaminants make people sick, and so we're able to understand what the most significant threats are, what food commodities are most likely affected by, and which bacteria affect them, so that we can then target our efforts and be sure we have the standards and we have the controls to minimize the most significant hazards. That's a key part of this prevention strategy. It's really doing, as you say, doing the risk assessment right, knowing what the significant problems are, and being sure we target those effectively.
So when did you have such an assessment system?
Well, this risk assessment approach has been developing over the last 10 or 20 years in the United States. We've been improving a lot our ability to understand foodborne illness, to be able to attribute cases of illness to particular bacteria and particular foods. And I think over the last decade, last 10 years or so, I've made significant progress in knowing what the most significant hazards are. Again, this is a work in progress as well. We'll continue to refine our data and to improve our ability to assess risks and target our efforts accordingly.
Okay.
Okay, thank you.
Thank you.